Lizett is coming to see Dr. Bonacici today for a lower facelift consultation, and on the phone when we discussed her objectives, mainly she was concerned about some changes that she's experiencing in her lower face area. So she described some jowls and a bit of skin laxity and some changes to her neck area. We're going to be having her meet Dr. Bonacici today for a lower facelift consultation.
I started thinking about it, and then I started checking websites, and Dr. Bonacici website was fantastic. It explained very well the process, his titles, certificates, everything, and that gave me a lot of confidence. It was like, this is the clinic that I need to go.
It was a pleasure meeting you, Lizett. You're here to see me today to discuss some options for facial rejuvenation. So some of the things we've talked about regarding the face are the areas that you might want to correct, how we might do that. So when I have you lean forward, I just want to have a look at the areas that are starting to sag a little bit. And in particular, you were commenting on your neck, and I think as well the jawline. And one of the things that I like to sort of see when I examine someone with a view towards doing a facelift is what kind of correction do we get when we pull towards the ears, and what kind of correction do we get when we pull behind the ears. I think in your case, one of the really most important things that we want to do is really tighten your neck. So I think it probably would be best to have the incisions that go behind the ear so that I can pull the skin from the neck up to that area and then remove the extra skin. The other thing I was thinking as well is that if we could bring your chin forward just a little bit, that would actually give you a nice long horizontal portion to your neck. And we could actually, through a small incision underneath the chin, put a little implant in there to give you a bit more projection. I think that might be very nice. That also is the same area that I go through to tighten up some of the neck muscles, so you don't have to have an extra incision to put a small chin implant in there. I also want to take a quick look at just where your hairline is. So when we're doing these types of surgeries, the design of the incisions is such that we want to camouflage the incision along your hairline and along the curves and contours of your ear. So I think in particular, I don't really want to move your hairline. I don't want your hairline to move up. So I'm going to make your incisions right at the very first hair in the temporal hairline, and that way the face skin will be pulled to that incision, and we won't actually be lifting your hairline, and I think that will look much more natural.
So Dr. Bonacici, will I have an incision here or here?
So you're going to have a small horizontal incision, and in fact you have a little crease there already. So I'm just going to make it right in the crease that you normally have, and that's something that many people will have. They often have a crease underneath the chin, and that's a natural feature. So even though you'll have a scar there, it looks like a very commonly occurring natural feature. The other thing is that when you're standing upright, that incision is actually facing the ground. So it's very, very unlikely that anyone would ever be able to see that.